What are value-based payments? Who do they affect and why do they matter? Welcome to the Care Payments podcast. I'm Fady Sahhar, president of XtraGlobex, and with me is Mandy Sahhar, the co-author of the value-based payment blog.
Really happy to be here.
Today, we're going to discuss value-based payments and discuss the introduction of the dual eligible population and how they affect value-based payments.
So, the goal of our Care Payments pod is to give you a quick hitting but informative discussion about healthcare payments, models, how they affect MCOs, providers, payers, and care recipients. As an advocacy first group, we want to ensure consumers are the focus of the new payment models whenever we can. So, Fady, can you give us a little about your experience in VBP?
We've been working with VBP since it was first introduced in 2012. And we've been writing the VBP blog since about 7 or 8 years now. So it feels really good to be at a point where we can be sharing this with you, especially as we see the emergence of the dual eligible population as an integral part of where this is headed.
Awesome. So, let's dig in. For those who don't know, what are value based payments?
So value-based payments have some basic tenets. They start out with the purpose is to improve quality of the services that we deliver. The recipients of the services should experience a significant improvement in their satisfaction with how they are receiving these services. On the other hand, payers for these services, insurance companies, government providers, as well as commercial providers, look to value-based payments as a way to reward high-performing providers, those who actually deliver the services in the marketplace. Therefore, that intermediary group, the providers of the services, are the ones who actually reap the financial reward associated with value-based payments, while the payers reap the rewards of savings when they achieve those values.
And then the consumers receive a higher level of care. So it really affects
And
everybody all the way around.
absolutely. And that also provides us the ability to create a much higher level of satisfaction. Those consumers are repeatedly saying that this is helping them in their quality of life, as well as in being more confident in the services that they're receiving.
So as we think about who value-based payments affect, we've talked a little bit about the consumers, but can you tell us who else they affect?
Well, the consumers obviously are the ultimate beneficiaries,
Hmm.
but and they're the ones who have the better quality of life, the better service. The providers who are in the middle, who are actually delivering these services, are able to reap financial rewards, but also efficiency and effectiveness rewards. So as they develop their programs in working with their payers, they're able to be very efficient in the way they deliver the services. The third group that benefits are the payers, whether it's government organizations, Medicare, Medicaid, or insurance companies in the commercial systems. They're also looking at these as these tools as a way to improve their profitability, improve their and reduce their total cost of care.
All right. So why does it matter? So yes, we can save money, we can offer better quality services, but why has this become such a big thing in the healthcare space?
Well, when you think of it, the rising cost of healthcare
Oh
is
yeah.
something that our community talks about all the time. As a country, we are very involved in managing a very high level of medical expenses. We're responsible for an aging population, and we are also experiencing higher level of knowledge and access to medications that improve the quality of life. But we cannot leave that in a vacuum of just adding to the cost of what we do. So the value-based payment programs allow us to balance out that quality with the delivery systems that are achieving that higher quality. So we're not paying for just units. We're not just paying for process,
Mm.
but we're actually paying for the outcomes and the results that come out of them.
That actually reminds me, when you and I first started the value-based payments blog, you helped me understand it by giving me a really great PCP example. I think for our listeners, that could be really helpful. Would you mind sharing that example?
Oh, you expect me to remember that far back? But
Let's try.
absolutely. When you think of your primary care physician, they're the individual or the office that you go to most often as a
Mm,
consumer. And when value-based payments made the PCP the primary node in the managing of value-based payments, they basically gave the physician and that office the ability to monitor the total care for
mm,
that individual. So they monitor, so if you have an elderly person, you monitor their awareness so that you monitor their cognitive development, but you also monitor their glucose levels to make sure
mhm.
that they are maintaining their medication delivery. And so, as the PCP, you are rewarded if your patients go to the hospital less often, end up in the ER less often, or are able to use medications that are equally effective without being very expensive. So the PCP was the first place where we proved that value-based payments can be very effective in the delivery of healthcare.
So that helps a ton, I think, as you explain it. But almost everything you just said was really related to physical health. So, can we talk a little bit about physical health versus long term services and other types of health at VBP?
Sure. Well, physical health is where value-based payments started.
Right.
So we have the most experience with them. And so today we can measure performance on a whole variety of episodic events. When a person think of a maternity process
Mm,
or a hip replacement process, which has a beginning, a middle, and an end, and where the care that is provided to the patient is very specific.
yeah.
Therefore, we're able to sometimes the more frequently you see a pregnant mother to monitor her progress, the more you are able to ensure that she has a healthy delivery. And but when you think of other services, think of behavioral health or long-term services and supports, where we are supporting people in their homes, where we are delivering much lower level of medical services. We are in very early stages in that arena, and so we are able now to look for ways to monitor the processes that long-term services and supports are delivering the services, rewarding those organizations that deliver services at a in a higher quality at a faster pace.
Awesome. So you brought up home care. I'd like to touch on that just for another minute here. So as we think about home care and value-based payments, what other thoughts do you have on how those two are connected?
Well, again, we have a very large population that
Mm,
receives home care,
yeah.
both through medical payers as well as private payers. And what we found is that we can structure the delivery of those services so that home care providers are the ones who see our patients the most frequently. They are able to report on their daily activities, any changes that occur in their life, but also to monitor simple things like how often they are eating. Are they eating nutritious foods? Are they taking their medications? Are they taking all their medications? Are they skipping? And how their mobility is improvement. So home care, as we think of the aging population in the US, is going to be one of the most vital areas where we can improve quality of life for a very large number of people. And we see value-based payments as being effective in being inserted into this environment.
Yeah, I mean, as we've written a lot of those blogs, home care has been such a theme throughout it, as it's grown and developed and changed. So I want to wrap up. We wanted to keep this quick hitting and short and informative. So as an advocate, we touched on it at the beginning. We consider ourselves an advocacy organization. As an advocate, how does what we talked about today impact consumers?
It's all about the consumer. As advocates, we're going to always look for the way to bring together solutions and processes that help our consumers live a better quality of life and live as independently as possible. So we see value based payments as being integral to that.
Love it. All right. So if you would like some more details on value-based payments, the basics, and much more detailed information, you can check out our 6 years worth of blogs at thevvpblog.com. You can always subscribe there for more. And be sure to check out the new dual eligible headquarters, or the resource for all things dual eligible, at dualeligiblehq.com. So DEHQ is our new venture. We're really excited about that. We're going to have our next podcast cover the basics of dual eligibility and dual eligibility consumers. So thank you for joining us, and we look forward to next time.
And as always, onward.